Hello, my name is Franco Buonaguro and I'm UNISON's West Midlands Regional Head of Health. I want to talk to those of you that value public services and in particular the health service. I want to take you on a trip down memory lane to 1979 to 1997 in particular. Many of you will remember walking into many major acute general hospitals across the nation. As you walk through the main reception area, quite often you'll be confronted by a large cardboard cutout of a test tube, and along the right hand side of the test tube you'd see figures: 200,000, 400,000, 550,000, upwards of 1 million plus. These figures are about how much money have been raised through fundraising events for life-saving equipment. Thankfully, since 1997 those test tubes have disappeared from our hospital receptions. We simply do not see them anymore. Also during that period, you will also recall the many occasions when you picked up your local newspapers and read time after time after time that theatre sessions had to be cancelled, hospital wards had to be closed due to shortages of staff. Since 1997 we've seen 250,000 new public sector workers employed in our hospitals and other public services. My message today is basically to persuade you not to throw the baby out with the bathwater. Let's not forget some of the fantastic work that's been achieved in our public services and the new buildings that have sprung up right across the country in every major city. New hospitals or totally refurbished hospitals instead of the old rickety leaking buildings that we witnessed throughout the 80s. We don't want to go back to those days. Now don't get me wrong, there are still many issues that I have issues with and my union has issues with this government, not least procurement, which is code for privatisation. We mustn't allow these issues to flourish into full privatisation where we see services put out to the private sector. The fantastic work that's been done around staff terms and conditions destroyed by privatising our members' wages, terms and conditions. It cannot be allowed to happen. However, on balance, you've got to make a judgment. Do we want to go back to those terrible days of the 1980s, or do we want to continue to enjoy and improve upon the major successes and the major development that has gone into our public services since 1997? So that's all I really want to say about the current situation regarding our public services and in particular the NHS. So don't forget, don't be short-sighted. Make sure that you have got long memories. Think back to the 1980s before you put your cross on that ballot paper at the next general election.